mean, there's more data created probably on a single person in a week than you could ever even comprehend. For a health system, I mean, it's orders of magnitude more than you could ever sift through across labs, vitals, orders, history, notes, and so forth.
My mantra has always been signal over noise, right? Signal is more important than noise. And we generate an incredible amount of noise every day, 99% of what we do.
Healthcare is riddled with a ton of data. You can imagine that one patient occupies at least an hour of time every time we start exploring their chart. We've had 4 people in the past that have had to do this work and have been behind constantly because of the manpower hours that it takes.
Prior to working with the Bunkerhill team, I had to have a full-time person just doing all the chart reviews to look up all the labs, the clinical criteria, the outcomes studies, and it was very cumbersome and often I think was very prone to error as well.
With the advent of generative AI, things that were previously impossible suddenly now become half a day's worth of task to automate.
Bunkerhill gives us the ability to structure this data, to automate our data, and to really just act on it in real time or as close to real time as possible to help these patients.
So Carebricks integrates with our full scope of patient data, labs, orders, notes, etc. And we can have the full breadth of context for a patient that's available to Carebricks for use. We first became aware of Bunkerhill in the domain of incidental coronary artery calcification screening. So in one example, we found a patient who came in, they had a chest CT for lung nodule screening, and they were flagged by the algorithm having a significantly elevated CAC burden. And so based upon that, we referred to cardiology. It ultimately resulted in a coronary artery bypass graft, so an actual surgical intervention that we feel like, really saved this person's life.
If you look at the primitives, you see a pattern of getting information about patients, doing clinical reasoning, and then taking some kind of action. And suddenly, that sort of pattern matches a lot of different applications within a health system.
So workflows we have really going on now, we have radiology actionable findings, lung nodule navigation, referral prioritization across multiple areas, HemOnc, GI, and so forth. Aspects of prior authorization workflows, case mix index optimization, obviously CAC, and so forth. I think we have 9 workflows at this moment that are active, and at least there are 2 or 3 that are basically begging to come to life as soon as we can let them.
It's saving lives. It's making people healthier and catching diseases earlier and making sure that we act upon them right away.
I can have this AI in the background that helps listen, helps create my notes, helps manage our processes within our system so that we can order the appropriate tests and make sure that there's appropriate follow-up. The most exciting part of AI in healthcare is yet to come. I think that what we're doing now is just the beginning, which is exciting. It's freakishly exciting.